Oh, there it is. Cool. All right, let's see who's here and see how this is gonna go. I did load up some of the pictures just for the digestive system. I'm gonna have them get them, but just so we can pop them up and say you should be looking at this one.
Yeah.
Right now, and we'll see. I mean, if it, I don't know if we can leave them. We can leave them up for a second so I can talk about it, and then we'll have to take it off. Yeah, exactly. Just to make sure they're looking at the right one because it's a couple different ones, and also for me too, so I can look. Oh yeah, it's this one. Yeah. Yeah, that'll work better. We'll see how it goes. I just probably have to wipe out his, the cavity just a little bit.
Yeah.
We cleaned it up yesterday, but just to, it's always a bunch of liquid in there, so we'll get that fixed up. All right, that should pop up. Let's get this opened up and see if anybody's on. Yeah. Get some more towels. Let's get this cleaned up. Bungee cords. That's it. Anybody on?
Yeah.
Okay, cool. Got some people on there. Good morning. Just cleaning up the table a little bit because we're going to be going into the abdominal cavity today, and I'm probably going to have to pause a couple times just to kind of get some of the fluid that accumulates in there out and everything, and maybe wipe it down a little bit so our picture's a little cleaner. So, yeah, we're just going to have to pause a couple times today while we do that. Not a big deal. All right, so this is what we're going to do. We are going to start with the anterior abdominal wall, right? And with that, we have some landmarks that we need to go over, and then we are going to do the muscles. And you have to understand that the abdominal cavity is already opened, so the muscles are cut, right? So we're going to kind of piece it back together as best we can. It's not going to be a perfect picture. You're really going to need to supplement what you're seeing here with maybe some pictures from your atlas or your textbook, or just some pictures online to get the full idea of what these muscles look like without being cut. There's really just not anything we can do about it. It's just in order to get into the abdominal cavity, I have to cut the muscles, and so that means that our picture is just not perfect. Okay. We'll do that, and then we're going to go do a once through the entire abdominal cavity, basically using the digestive system as our kind of guide through the abdominal cavity. So we're going to do that. Now, a couple of administrative things, and do you think you can just turn the white balance on and off real quick, see if it, get rid of that yellowness. That's perfect. There we go. So just a little bit of administrative stuff. So I'm not going to have time to do the brain with you guys directly. So what I'm going to do is I'm going to link to a YouTube video I have that shows the full process of actually taking the brain out of the body. It's a really good video. It's done really well. Production quality is really good. So it's better than what you're going to see on camera anyway. For whatever reason, doing the brain on like live doesn't work really well. There's a lot of shadows. It's hard for me to get everything positioned just right so that you can see what you need to see. I'd rather use the better video. You're going to see it better. It shows you it actually happening, which is worthwhile. So I'm going to link that up in the announcements. And just know that there will be some questions from that video on the practical, but nothing difficult. Meaning if you just watched the video, you're going to be fine. Right? There's nothing to worry about there. You don't have to go crazy and study a ton. I will have less questions on the brain because we're not going to go over it together. But I will have some on there just to make it so that you guys do watch that video because I do think it's worthwhile. So I will post a link to that. Now, we also need some quizzes. The problem, and this happened to me last summer too, is that since we have 2 classes a week, I need to get all of the dissection done for the next class before we get to that one, and it's really like time crunchy in the summer. It's hard for me to keep up, so that we actually have stuff to go over and do, and it's cutting into my time to do quizzes. So what I'm going to do is post up the quizzes that I did for the spring semester, all right? Now, it's on a different cadaver, but it shouldn't matter, all right? Meaning if you have reviewed and if you are ready to take a quiz, that seeing a different body, but me talking about the same things and asking questions in the same way and showing it in the same way, the fact that it's a different body shouldn't make a difference, okay? So at least for now, I'm going to get them up so you guys can practice a bit. If you have questions, definitely come on to a help session and I will help you out with that, and we can compare and contrast how maybe that, the body that's in those videos might look a little different from the one that we're seeing, but again, it shouldn't matter in the way that you answer the questions. The fact that it looks different, because things are maybe a different size or whatever, shouldn't make a difference, okay? But at least then you guys can start practicing. If I can get caught up before this midterm practical, I will record some actual quizzes off of this body. But again, with the resources you guys have, it shouldn't make a difference. If you can answer the questions, obviously on those quizzes that I post up on a different cadaver, you're going to absolutely get them right on this cadaver, all right? So that should catch us up for some of that administrative stuff. All right, let's see what we got here. I think first, I think I'm going to show you the skeleton for a second and also myself just for a minute so I can kind of highlight where some of these areas are. Then we'll get right on the body and then find the same exact things there and find some of these bony landmarks that we need. And then we'll hit the muscles. All right. So we'll be posting them up in chat. Now, also another thing is you guys, if you go to Canvas, right, and go under the lab module, you'll see some JPEGs on there. Digest 2, 3, 4, and 5. We're going to be, you want to have those handy. So you're going to want to download those or have them up on a different tab or a different device so you can look at those images. All right. We are also going to kind of put them up on the screen briefly when I am referencing them so you know which one we're talking about. But there's not enough real estate on the screen to keep them up and go over what we need to go over. So I'm going to kind of put them up, talk about how you're going to relate what you see to on the body to the drawing, and then we're going to take it off, right? So again, if you guys have your phone or you have your laptop, you want to open it up on a separate tab or download those things on your phone, but you want to go under the lab module on Canvas, Digest 2, Digest 3, Digest 4, Digest 5. Those JPEGs you're going to want to have handy. It's not absolutely necessary, but it does make it a lot easier for you to understand what you're looking at when we're going through the digestive system. Good question?
Yeah, Jillian asked if the practical is going to be live or if it's pre-recorded.
Jillian, right? So Jillian's asking if the practical is going to be live or pre-recorded. It is live. It is live. The quizzes, I pre-recorded them, but they are, you'll see when you take the first quiz that I explain how to take the quiz so that you can mimic how it would be when it's live. All right, so the quiz, the format of it is very much designed to get you ready for how the practical format's going to be. But the practical will be live. We'll be doing it real time, just like kind of we're meeting now. And I will explain exactly how we do it, all the rules and everything, and exactly how it's going to go. I will explain that right before the practical. So we're going to get together on Big Blue Button before the midterm practical for 10-15 minutes. That way we can go over everything, and everybody will have a chance to ask questions if they have them, so that everybody is absolutely clear on how it's going to go. Then we'll switch over to YouTube and we'll actually do the practical. So again, it's nothing to worry about right now, especially after you take some of the quizzes. You'll get used to the format or whatever, and that will answer, I think, some of the questions you might have about how it's going to be conducted. All right. Okay, so let's get the skeleton over here. And let's get a little closer, something like that. All right. So when we're looking at the abdominal cavity, right? Let's see. Yeah, just want to make sure we got what we need on here. So when we're looking at the abdominal cavity, there's a couple of landmarks that we need to be able to identify. First is going to be the inferior margin of the ribs, and we're going to be able to see that, no problem. So it's just coming up along the costal cartilages here, up to the xiphoid process, and back down along these costal cartilages here. So we're going to be able to find the inferior margin of the ribs. Excuse me. We're going to note where the xiphoid process is. We're going to be able to palpate and see where that is. Pubis bone down here, a little bit of hip osteology that we need. There's only a couple spots. We're really going to do the hips in more detail second half after the midterm practical, but there are a couple of bony things that you want to be able to identify. Now, one of them are the pubis bones down here. The other thing you want to be able to find is the very front of the iliac crest. Okay, so right, if you put your hands on your hips, so right now, just take your hands and just put them. Rest them on top of your hips. Your hands are resting on top of the iliac crest on either side, right? That's that bony ridge that you can rest your hands on. Now, if we follow that iliac crest out to the anterior most portion of it, all the way to the front, you're going to run into a point, and that's going to be called the anterior superior iliac spine. All right, and that's going to be up in the chat there, right? So again, the anterior superior iliac spine is the anterior most part of the iliac crest. So again, put your hands on your hips, feel that bony ridge, and then move your fingers all the way till you get to the front of that bony ridge, and it's those bony points that stick out on the anterior side of your hips on either side, right? That's anterior superior iliac spine. So we want to be able to note those couple of parts. Now, what we're going to see when we do the muscles in the abdominal cavity is that there is some connective tissue that we need to be able to identify. There's a couple of ligaments, right, that your abdominal muscles are going to attach to. So first one you want to identify is a ligament called the Linea Alba. Linea Alba. And that's a ligament that's going to connect the xiphoid process straight down to the pubis bone down here. So it goes up and down along the midline of the abdomen. That's going to be the Linea Alba. And that ligament there serves as an attachment point for the two halves of your anterior abdominal wall. So you have muscles on this side, you have muscles on this side, and those muscles are going to connect to each other along the midline by connecting to that Linea Alba. All right, so that's one thing. You want to note that your belly button, or the better term, umbilicus, is an opening within the Linea Alba. So it's a split in that ligament, right, that allows things to pass in or out of the abdominal cavity. That would be your umbilicus. All right, so we got that one. Next one you want is on either side of the Linea Alba, we have another ligament, right? I mean, it's quasi-ligament, but we'll call it a ligament, that connects the inferior margin of the rib cage down to the pubis bone again. All right, and it's on either side of the Linea Alba, so it runs parallel to it on either side. And that's going to be called the semilunar line. The semilunar line, or linea semilunaris is just another name for it. So either one you want to use is acceptable. Semilunar line or linea semilunaris. So based on the name, you hear semilunar. It's half moon shaped. All right, so it's got a curve to it, right, and it's on either side of the Linea Alba. Now you guys have seen this. If you've seen somebody who has defined abdominal muscles, right? So you look, if you have a six-pack or if you look online, you pull up like a picture of a bodybuilder who's flexing their abdominals, right? You'll see that six-pack muscle going up and down in the middle of their abdomen, all right? That muscle is called Rectus Abdominis, which we're going to see it in a little bit. But what you'll note is that in between the six-pack, you have that depression that runs along the midline of the abdomen. That's the Linea Alba. And then there's a defined line on either side of the six-pack. That's the semilunar line. All right, so you guys can see those spots. And then the last thing we need here before we look at the body is we have another ligament that connects these two spots down here. It connects the anterior superior iliac spine over to the pubis bone, right? Kind of sits like this, connects those two spots, and that's going to be the inguinal ligament. Inguinal, all right? And that ligament serves as an attachment point inferiorly, like the bottom of your abdominal cavity, for your abdominal muscles to attach to as well. All right. So last thing we should mention here is that when you think about, you guys have probably heard the term hernia, right? When you get hernias in your abdominal cavity, those are tears in your abdominal wall. So it's basically a spot where the muscle pulls away, right, from connective tissue. So where the muscle's attached to that inguinal ligament, you can get an inguinal hernia there where the muscle will pull away from that connective tissue and there'll be a hole there, an opening. You can also get umbilical or midline hernias as well, and that's where the muscles will pull away from the linea alba or the linea alba will split a little bit. There'll be a separation in the linea alba or in that inguinal ligament, right? So hernias are just spots where there's an opening in that anterior abdominal wall that allows some of your abdominal contents to try to get out through that opening. Okay, that would be a hernia. Typically, they occur along the midline, along the linea alba, or along the inguinal ligament. All right, so let's get over onto the body and see what we can see. Now, again, just note that the picture you're going to see is messy because we had to cut open the abdominal wall. So I will put it back together as best I can, all right, but it's not perfect. So you're going to really want to couple what you're seeing here with looking at, what's the best way for me to do this? Sorry. Oh, I just knocked the cord. Sorry. Let's get up nice and high. That's good. So you're going to want to couple what you're seeing here with some pictures of an intact abdominal wall. And again, you can grab those out of your reference materials, or you can just Google an image to be able to see what it looks like together. So let's take this off here. All right, so what are we looking at? I am standing right now on the right-hand side of the body, okay? This is towards the head. This is towards the hips, right? So superior, inferior, okay? Here's the midline of the body. So this is medial, this is lateral. Again, I'm standing and I'm looking in on the right. All right, so what are we seeing here? Right here, see what I'm moving here? This is that inferior margin of the rib cage. Remember, we cut the breastplate off. There's the breastplate, so we had cut that off. So here's the bottom of the rib cage, which means this point that my finger is against right here is, sorry, just messed up my camera. This point right here is the xiphoid process, right? So here's that inferior margin going along the costal cartilages down here, down there. And again, you can see a little bit better if I move it around, right? So there's the bottom of the rib cage. Down here, right here, my finger again is against here is the top of the pubis bone. Okay, so we got that. We can see right here, hopefully, let me grab my, just need a probe. Where did I put them? Oh, over here. Probe. So right along here, you guys should be able to see some connective tissue right there, that kind of whitish lines that you're seeing there. That is the inguinal ligament, right? And it's going to connect from this bony spot that's sticking up here, which is that anterior superior iliac spine, over to the pubis bone. So we got inguinal ligament there. We're going to have the same thing on the other side, but you can see this one pretty well there. That's inguinal ligament. And then the linea alba is going up and down along the midline here. Now, again, that's a little tough to see because we cut it. All right, so let's see if we can get this together here. Let me grab the ends of this. So I want you to see that I have cut open the abdominal cavity. And let's take a look at what we can see. So here's the umbilicus. That's the belly button, which I left. And we need this as a landmark. So there's the umbilicus, right? You can see where I separated this here. Let me grab this side and this, whoops, grab these two things right there. So that's where I cut the linea alba. See how that would have been stuck together like that? And we cut the linea alba open so we can get inside the abdominal cavity. So if we just kind of, right here, there's one edge along the linea alba, and then here's the other side. And again, we just kind of cut that in half. Just cover this back up a little bit. Right, so we cut that right along there. Right, so we opened up that linea alba, but that would have gone up along here, and again, the umbilicus would be in the middle of that. Now, let's see how well we can see this here. Yeah, pretty good. All right, so you see there's a line like right along here where we have a color change. See, it's darker, right, to lighter. I'm just going to kind of lay the probe right about where that color change happens, right about there. That's where that linea semilunaris is going to be, right? So again, I'm holding where the linea alba was. The linea alba was here. We cut that. And then right about where you see that color change in that area there is where we're going to have the linea semilunaris, okay? And again, I'm going to re-show you some of this stuff. It's just to give you an idea of what we're looking at. All right, so in order for us to get into the abdominal cavity, we had to cut it. So I just want you to see where the cuts were, and then so you'll be able to make sense of how we're putting this back together. So again, I made a cut from the xiphoid process down through the linea alba to the umbilicus. And notice I stayed on the left side of the umbilicus. That was on purpose. So I come down through the linea alba. I stay along the left side of the umbilicus right here. Okay, we make that cut. Then we go from below the umbilicus, and you can see right here that we made an incision from below the umbilicus over to the anterior superior iliac spine on this side, and then over to the anterior superior iliac spine on that side. So you can see here, see, we made a cut on that side too. So that gives us 3 abdominal flaps here. We got one down here that we're going to be able to move out of the way. We got one here that we're going to move out of the way. We got one over here that we're going to move out of the way. So that's what we cut. Down on the left side of the umbilicus, and then that way, and then that way. Those are the cuts. So let's go over the muscles. Now, what I want you to see is that I left all the muscles intact on this side, and I sectioned them on that side. So we do the muscles in a second. I'm going to show you here first, and then we're going to move the camera around and look over there. You can see how, see this stuff? See how I can take this, move it out of the way? See that? Right? That's this stuff here. So see right here? The equivalent spot would be over there. So I cut through some of this connective tissue here so that we could get underneath of it on that side, right? And that's going to expose some muscles. All right, so what are we looking at here? On this side, with everything intact, right here where you see it's whiter, okay? This is called the rectus sheath, the rectus sheath. And the rectus sheath is formed by a flat, sheet-like piece of connective tissue called an aponeurosis. All right. Anytime you see the word aponeurosis, that is, you're going to think a tendon. So you're going to insert the word tendon for aponeurosis. Okay. And it's a specific type of tendon. It's a tendon that is flat and sheet-like. And again, it's what you're seeing over here. So you see this just is like a membrane, right, that we're kind of moving out of the way. This is actually a tendon, but it is a flat, sheet-like tendon you see that covers over that muscle there. Right? That's called an aponeurosis. So what we're seeing right here is an aponeurosis. And again, if we cut this and we open it up, we'd see that same muscle that we see on the other side. So there's a muscle underneath of this. And then there's another piece of the aponeurosis behind the muscle, right? So it forms a pocket like this. See? Like this. There's a piece of aponeurosis. There's another piece of aponeurosis. They come together like this, and they form a pocket in between like that. That's the rectus sheath. That pocket formed by the 2 pieces of aponeuroses. And what's inside the pocket? That muscle that we're seeing over here, all right, is sitting inside of that pocket there. Now, let's see if we can see that right here. All right, look at this. Whoops. And so you can see here that we're going to lift away. You see how Actually, you know what? I'm going to zoom in a little bit. So we're going to zoom in right on this so you can see what the cross section looks like in this area. So you can really see that pocket, that rectus sheath. All right. So we're going to lift up, and I'm just detaching a little bit of that glue-like fascia, right, from the muscle here. Let's just get a little bit of this off. Something like that. All right, so you see how I'm holding the muscle here. You can see how this would sit on top, and you can see that glue in there like that. And then if we flip this over, right, we look on the underside, and there's that other aponeurosis on the bottom, and you can see there's some glue holding it together in there as well. We're going to peel some of that away. All right, so let's just do that. All right, there you go. So you can see right here, if we kind of hold this like this, there's the sheath. See, I'm holding the sheath open, and you can see in between the sheath, we got this muscle in there. So this is the rectus sheath formed by an aponeurosis on top, an aponeurosis underneath with a muscle in between. So you guys can see that. You see how when I pull this apart, I can't separate it in the middle, and I can't separate it over here. Why? Because that's where these aponeuroses that I'm holding connect to the linea alba along the midline. So where this stuff comes together right there, right where it comes together there, that's the linea alba. And where it comes together over on this side, I'm trying to do this on the camera here, where it's coming together over here, you see where it joins right there, that's the semilunar line. Okay, and you see how that corresponds to kind of what I showed you before. Okay, all right, so let's go over to the other side. Now that we got that, let's identify the muscle. So we're going to swing around to the left-hand side now. All right, so let's make sure we're good. We can come in just a touch here, something like that. Okay, so now I'm standing over here on the left-hand side instead. So here's that midline. That's where the linea alba was. So let's look at this here. So we're going to stretch this out a little bit, get it back in place. Okay, and over here we cut through the aponeurosis. So you can see how we can peel the aponeurosis back this way, and you see how it's kind of stuck on the midline because that's where that linea alba is. And we can take this aponeurosis and we can pull it back towards ourselves this way. And notice how I can only pull it that far. Why? Because it's stuck and connected along the semilunar line. So we opened up the aponeurosis. We're inside of that rectus sheath now. And what do we expose? Rectus abdominis. That's the first muscle we want to identify here. Rectus abdominis. Okay? You can see this muscle. The fibers are going up and down this way. And this muscle connects from the very bottom of that, the margin of your ribs, right? So right on either side of the sternum, it's going to connect here right towards that inferior margin of the rib cage, and it's going to go all the way down and attach down to the pubis bone here, right? So you can see I had to cut the muscle here. Right, so there's the bottom half of the muscle, there's the top, right? So we had to cut that apart, but this muscle would go straight down here, down to there, and it would do the same thing on the other side of the linea alba, right? Notice that rectus abdominis has breaks in the muscle. So you see how we see contractile tissue here. Here's the muscle belly, and then there's a break in it. There's a break in it there, right? If I stretch this out, you can see another break in the muscle right there. This muscle is segmented. So your six-pack would be this part of the muscle contracting, this part of the muscle contracting, and that part of the muscle contracting there. So that would be 1, 2, 3 bumps on this side. You'd likely have a similar thing on the other side. And then from here down, this part doesn't really stick out at all, right? So when you say somebody has a six-pack, there's actually 4 segments, right? 1, 2, 3, 4, but you only really see the top 3 above the belly button, not too much below. At least doesn't stick out like your six pack does, right? But it's all one muscle. Now, note that a number of segments that you have in the muscle is genetic. It's not something you can train. So some people have an 8-pack, some people have a 6-pack, some people have a 4-pack. That is the function of how many breaks there are in the muscle, which is genetically determined. It's not something where if you do more training, you're going to develop more bumps there, right? It might be covered up by fat. Maybe you're not seeing all of them, right? But the actual number of bumps you have is genetically determined, not determined by training. All right, so let's talk about function for this one. So rectus abdominis, the muscle is oriented up and down, right? So it's operating in that vertical direction. Now, if we have a bilateral contraction, so which means that rectus abdominis here and over there, they both contract at the same time. The right and the left one contract at the same time. Well, then we're going to move our rib cage closer to our pelvis. These two things are going to get closer together. Because really, this muscle can operate both ways. We can pull this way, which will move the rib cage down that way, or we can pull this way, which will move the pelvis up that way. So typically, when you do an abdominal crunch, you're moving both of those things together, okay? And that would be the bilateral function for rectus abdominis. And that is going to be flexion of the lumbar spine, all right? Because if we move the pelvis and the rib cage together, the bones that are located between the pelvis and the rib cage are the lumbar vertebrae, right? So we're actually bending the lumbar spine by moving these two things closer together that way. So we get flexion of the lumbar spine. Again, that's bilateral. If instead we have a unilateral contraction, let's say only the right hand rectus abdominis contracts. So I'm over here. I'm sorry, I'm on the left side. Only the left side contracts. And this side pulls down, only this side. What happens? Spine bends this way. If only the right side contracts, then the spine bends that way, right? That would be lateral flexion. So we get a unilateral contraction of rectus abdominis, we get lateral flexion, which is always to the same side. So if I'm on the left, spine bends to the left. If I'm on the right, spine bends to the right. So you want to note that the abdominal muscles function like spinal muscles that we did on the back. They're going to be analogous to each other. Right? So all the spinal muscles we did are going to work in conjunction with the abdominal muscles that we're doing right now, and they're going to be the ones that really move your spine around. All right, so that's rectus abdominis. That's the first one. So let's put the aponeurosis back like that. We'll cover back up rectus abdominis. And what we want to do now is we're going to go lateral to the semilunar line. So right now we were just doing where that rectus sheath was. We were in between the linea alba and the semilunar line. Now we're going to go lateral to the semilunar line. And what we're going to get over here are 3 muscles that we're going to run into. And those 3 muscles are stacked on top of each other like this. All right, so we're going to have 1, 2, 3 muscles all stacked on top of each other. And those muscles are going to go in different directions. Okay, so we'll list out the 3 muscles. They're going to be external abdominal oblique, internal abdominal oblique, and transversus abdominis. All right, those are going to be the 3 muscles. And the way we just listed it is from superficial to deep. So first one you run into is external abdominal oblique. We move that one out of the way. We got internal abdominal oblique. Move that one out of the way. We have transversus abdominis. So they're stacked on top of each other. All right. Now, they also, like we said, they travel in different directions. So what you're going to know is external abdominal oblique from top to bottom. So this is superior, this is inferior. From top to bottom, those fibers are going to travel medially like this. So external abdominal oblique fibers go medially from top to bottom. Internal abdominal oblique fibers go laterally from top to bottom. And transversus abdominis, the fibers go horizontally, as the name suggests. Transversus, they're going to go transversely or horizontally. So we're going to have external like this, internal like that, and then let's just put this down, and that will be transversus. All right, so we're going to be, here, like this. All right, external this way, internal this way, and transversus that way. So those will be how the layers will stack up like that. Okay, those would be the directions of the fibers. And then we'll have the same thing on the other side. All right, so let's identify these. So right here, we're going to just move the camera a little bit like that. So we're going to look a little bit more from the side, if I can get it to stay where I want it to here. Something like this. Come on now. There we go. All right, something like that. So hopefully you guys can see here, right? Here is external abdominal oblique, and you can see the tendinous part of it there. Hopefully you can see the fibers going that way, and you can see all the muscle fibers up here. They're going that way. So that's what I said, from top to bottom, they go medially. That is external abdominal oblique. So we cut part of this out of the way. All right, so I can grab this without grabbing all this stuff underneath of it. So we're going to take this bit and we're going to reflect it. And notice how, see, it's stuck along here. What are we stuck on? That semilunar line, right? See how everything attaches there? So we're going to reflect this muscle along the semilunar line. So that's external abdominal oblique. The next one we run into is internal abdominal oblique. And look at that. You see how you get a nice picture of all the muscles, and you see how the fibers are going this way. So from top to bottom, they're going laterally. So external was like this, right? This way. Internal is going this way. They crisscross. All right, so that's internal abdominal oblique. Again, we're going to reflect this, and what are we stuck on? Semilunar line. And what are we left with? This last layer, that is transversus abdominis. And look at those fibers. See how they're going completely horizontally. All right, so those are the three layers that we have. And again, if I asked this, I would come over to the side like I did there, and I would say, in this area, we have three muscles, right? I want you to identify the first one, right? This muscle here, right, going in this direction. Or I'd take this and I'd say, I want you to identify the second one. This muscle here going in this direction. Or I want you to identify the third one, that muscle there going in this direction. So I'd be pretty clear as to what I wanted. And whenever we have multiple things in the same area, I will tell you we have three things here. I want the first, the second, and the third. So I'll try to group them together so you know what you're choosing between here. Okay, so let's talk about function. Now, I'm going to just zoom back out a little bit so we can see the body a little better like this, because we need to really kind of see both sides for this. All right. So, external abdominal oblique. Those fibers are going this way, we said, right? On this side, they're like this. On that side, they're like that. So this would be external abdominal oblique. If we get a bilateral contraction, and both sides are going to contract at the same time, and we're pulling like this, right? We're still going to get flexion of the lumbar spine. Both sides are pulling like this, rib cage and the pelvis move closer together. That would be bilateral. If we have internal abdominal oblique, right? Those muscle fibers are going to be going this way, like this. Again, if we get a bilateral contraction, pulling like that, we're still going to have rib cage, pelvis move closer together. We're going to get flexion of the lumbar spine. For transversus abdominis, okay, those fibers are going this way, completely side to side. So when they pull here, we do not get flexion of the lumbar spine. Why? Because we don't have a vertical component. All right. So transversus abdominis, the fibers are 100% horizontal. There's no vertical component at all, which means we don't get that flexion. The other two, regardless of whether they go this way or that way, when they pull, there is that vertical component, so we do get the flexion. All right. But transversus abdominis, you're going to make a note there, no flexion of the lumbar spine because there's no vertical component to its line of action. All right. So that would be for bilateral. And we'll get to what the bilateral function is for transversus abdominis in a second. Unilateral, all right? We get a unilateral contraction. So we have external abdominal oblique is going to pull this way, or you could say that it pulls that way. It doesn't matter. If I say pulls this way, we're moving the ribs like that. If I'm saying we're pulling this way, we're pulling the pelvis this way. And it operates both ways, so it doesn't matter. It's going both ways, right? What's going to happen here? So we get a unilateral contraction. So I'm going to say we're going to pull like this. And again, when we have a unilateral contraction, we break it into its component parts, right? So if I pull this way, that is going to be the same as me doing this. Vertically, like that. Horizontally, like that. Vertical, I grab the bottom of the rib cage and I pull it straight down only on the left side. What happens? Spine bends to the left. If I did the same thing over there and I pulled down on that side of the rib cage on the right, spine bends to the right. So we get lateral flexion. All right, that'd be the vertical component. What about the horizontal component? We know from the spinal muscles that when we're talking about unilateral contractions and we're talking about horizontal components that we should be thinking rotation, okay? So in this case, the horizontal component is going to pull in this direction, which means I'm going to grab the ribs and I'm going to pull the ribs this way, right? Like that, which means that the body is going to face away from me. All right, I'm on the left side, but if I grab the ribs and I pull them this way, see, I'm pulling them to the right. I'm on the left, but I'm pulling the ribs to the right, means the body's going to rotate to the right. That's an opposite side rotation. All right, opposite side rotation. What are we rotating here? These abdominal muscles, they're rotating the lumbar spine. That's what they're going to activate. All right, so external abdominal oblique is lateral flexion and opposite side rotation. Those would be the two movements. Now, what about internal oblique? So again, let's move external. Whoops. Let's get external out of the way. Look at internal. Now, internal fibers are going this way now, right? So when we do that, again, we break it into its component parts. So if we're going to pull like this, that's going to be me pulling this way. See how that equals that, right? Again, we got that vertical component, lateral flexion. And now the horizontal component is pulling the other way. So I'm going to grab the ribs here. Now I'm going to pull them towards me. Okay, I'm on the left and I'm pulling the ribs to the left, which means the body's going to roll and face me. That would be a same side rotation. All right, so again, notice between external and internal oblique, we change the direction of the muscles. All right, when we do that, the horizontal component changes. For external oblique, pulling this way, the horizontal component goes in this direction. For internal oblique, pulling this way, the horizontal component goes in this direction. See how the horizontal component would work against each other. External would pull to the opposite side. Internal pulls to the same side. Okay? And then again, we said transversus abdominis, right? Those fibers are 100% in the horizontal direction. So we said there's no flexion there, right? Because it doesn't have any vertical component, but it's all in the horizontal direction. So we would expect that if we get a unilateral contraction of transversus abdominis, those fibers are going to pull like this, that we're going to roll the body towards us. And if we're on that side, we'd roll the body towards us, right? So it'd be a same side rotation. And it does. Transversus abdominis does do same side rotation, all right? But in order to do it, it needs to act with other abdominal muscles at the same time. And the reason for that is because look at what this is attached to. Transversus abdominis is attached to the bottom of the ribs, top of the hips, okay? And it pulls on what? When it's pulling here, what's it pulling on? The linea alba, all right? The linea alba is a ligament, and it's malleable. It's not a bone. It's not rigid like a bone, meaning if I contracted transversus abdominis on this side and nothing else, just this one muscle and nothing else, right? What would happen? I'd pull on the linea alba, and the linea alba would move over this way. You'd see it by your belly button moving over there. And if I did the same thing on the other side, the belly button would move. It wouldn't actually cause you to rotate, because it would be pulling on that linea alba and the linea alba would move, right? So if we want to get rotation, we would need this muscle to contract at the same time another muscle contracts on that side, which holds the linea alba in place, and then they could work together and do that rotation, okay? So what else does transversus abdominis do for us? What special movement? If we get a bilateral contraction of transversus abdominis, and we said that bilaterally, when it pulls like that, it's not going to give us flexion of the lumbar spine. But what will it do? It's going to pull on the linea alba this way. That side will pull on the linea alba that way, and it's going to tug on the linea alba. That causes your abdominal cavity to flatten. So basically, when you suck your gut in, right, and you tighten up your anterior abdominal wall by moving the wall inwards, right, we call that compression of the abdominal cavity. Compression. And that's a special function for transversus abdominis. Now, the other muscles can contribute to compression as well, but this one is made for it. That's what this one does. It sucks our abdominal wall in, and it makes the volume inside the abdominal cavity smaller, right? That's what compression does. And when we do that, we increase intra-abdominal pressure. All right, so when we make the abdominal cavity smaller, it's a sealed cavity, pressure goes up in there. So we can use that for a couple different things. One, digestively, you're going to use that for elimination. All right, when you're pooping, you're compressing your abdominal cavity. You're creating pressure in here, which pushes things out, right? The other way we do it is in a functional sense. Think when you're going to lift something heavy. What do? You tighten up your abs. And you'll do it even if you're not aware of it. Everybody does it involuntarily. If you're trained, so let's say you do a lot of strength training, you do that on purpose before you lift something heavy. And we call it bracing, right? So if you're going to lift something really heavy, you're going to brace your abdominal cavity. Tighten up those abs, right? You're compressing the abdominal cavity, increasing that pressure, and that increased pressure is pushing all of your intestines and your organs in here up against the lumbar spine, supporting it, right? So increased abdominal pressure by doing compression supports the curvature of your lumbar spine when you're lifting heavy things, right? That's the other thing we use. So like your transverse abdominis is a built-in weightlifting belt. Have you ever seen somebody use a belt in the gym? You have one right here that just needs to be trained a little bit more. Okay? All right, so that takes care of the movements for those muscles. Now we have one more muscle, and then we're going to actually get into the abdominal cavity here. And the last muscle we're going to have is one called Pyramidalis. Pyramidalis. It's a very small muscle located at the base of your Linea Alba. Very bottom of the Linea Alba on either side, we have a tiny little muscle called Pyramidalis. Now, we're going to note that Pyramidalis, you're going to, if you have your handouts, put a little asterisk by that one, that it's variable. Meaning that some people have it, some people don't. Some people it's more well-defined, other people it's less well-defined. Any of the variable muscles, anytime you hear me say a muscle is variable though, excuse me, just note that that means if you're missing it, it doesn't matter. You're not going to lose any function, any noticeable function from not having a variable muscle. All right, so where is this one located? It's over here. So we're going to go down, we're going to move down. Here's the pubis bone here. So we're going to look right down in this area. Just going to come down. I'm going to zoom in a touch so we can see a little closer here. So we're way down the bottom here. And sorry if I can get this positioned right. Oh, God. Just doesn't want to stay where I put it. Okay. Good enough. Right there. All right. So look at here's the aponeurosis that was covering rectus abdominis down here. So let me just get this back into place. Right. There's the aponeurosis that's covering rectus abdominis. So we cut that here. So we're going to open this up so we can see rectus abdominis, at least the bottom portion of it. Go like that, right? And right here, look as I pull. Right here, you see this. I'm going to outline this muscle right here. See this little guy? Here's rectus abdominis. There's the bottom of it there. And then you see this little triangle-shaped muscle that's sitting on top of rectus abdominis right at the base of the Linea Alba. That's pyramidalis. This guy that I'm moving right there. Again, you can see me kind of pulling on it there. So it's called pyramidalis because if we had the other side too, right here, 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 and you had another one on the other side going like that. See how it would make like a pyramid shape right at the bottom of the Linea Alba there. And this is one half of it. We'd have the other half on the other side over there. That's pyramidalis. So we do have a good example of it. You can see it pretty well. Okay? And what does that muscle do for us? Again, it's not necessary, but it does when it contracts. It tightens up the Linea Alba to provide some tension to it. But again, it's not necessary. If you didn't have it, it would not make a difference. Okay, so that takes care of the muscles and the anterior wall. So we already talked about how we opened up the abdominal cavity. And we said we did it by, get in here, cutting the Linea Alba and then making incisions going side to side so we can open this up, right? So we're going to do that in 1 second. In order for us to do the abdominal cavity effectively, what I like to do is follow the digestive system down. All right. So we're going to start at the very beginning of the digestive system. We're going to go all the way up and get into the back of the mouth. All right. We're going to start there. Then we're going to follow the beginning of the digestive system down through the back of the throat. And then we're going to talk about how it goes through the thoracic cavity. And then we're going to get into the abdominal cavity. We're going to kind of follow that digestive system kind of in order so that we know that's going to allow us to figure out where we are in the abdominal cavity. I think that's your best roadmap for identifying things in the abdominal cavity is based upon their location around things in the digestive system. Plus, if you do the whole digestive system, you've done 90% of the things that are in the abdominal cavity anyway. And then you just got to remember where there are some other things located around it. Okay? So let's start up top. See how this goes. So we're going to slide up a little bit and we're going to come up here so we can see the head. And we'll have to reposition in a second, but I'm going to get this set here. Sorry, that's better. That's all right. So let's get this uncovered. All right, so we got the head uncovered here. And what I want you to note is that right now, the skull is not attached to the neck anymore. I separated the skull and the cervical vertebrae. That's so that we could lift the head up out of the way and we can look into the back of the throat. So let's just see. I don't want the head to roll. So I'm going to shift over to the side so you can kind of see what we did here. This, if I could just get this to move down a little bit, something like, come on, camera mount is not working with me today. Something like that. Stay for a second. Okay, so watch this. So move this a little bit. I'm going to get that breastplate out of the way just a touch, like that. All right, so we're going to take the head, and we're going to lift the head up and off like this, and move it down here, like that, okay? And we're just going to put some toweling in here just to keep the head so it doesn't roll on us, like that, okay? So here, we can see, here's the cervical vertebrae that I'm moving here. My fingers are running along the bodies of the cervical vertebrae. And here's the top of the cervical vertebrae here. So we cut this so that we remove the skull off of that. Now, let's change our camera view so we can look from the back here. So let's come around this way. And we're going to zoom in, but I'm going to keep the view out just a little bit in the beginning so we can see a couple things, and then we'll zoom in on it. All right. Is that just not, there we go. All right, so what are we looking at here? So we can see the tops of the shoulders here. Here's the top of that cervical vertebrae, right? Look at all that muscle around here. That's all the muscle that holds your head onto your neck there. So we had to cut all that muscle off the base of the skull. Hopefully you guys can see here. Let me grab my probe. 1 second here. Some forceps. All right, look right here. And you guys see this thing that I'm moving there. That's the spinal cord, right? So we're in the vertebral canal there. And look at how that matches up to this. See, up there? That's where we cut the spinal cord. Here, here, when we removed the head off of the cervical vertebrae here, right? So we cut all the muscles, cut the spinal cord. We separated a joint, and the joint we separated is between the occipital bone. So we're looking at the bottom of the skull here. So this is the occipital bone that we're looking at here. We separated the occipital bone from C1, which is your atlas, all right? And that's the Atlanto-occipital joint that we separated. Atlanto-occipital. Atlanto for axis, occipital obviously for the occipital bone. The Atlanto-occipital joint. We separated that. That's the joint that allows you to nod your head yes. When you nod your head up and down, right? That's that joint that you're articulating. And I went in and I separated that joint and cut everything. Okay? So that's kind of how we got to where we are. Now, the reason we did that is because here, this is all of your throat structures. Right? So remember when we talked about the throat, in the anterior neck, we talked about the hyoid bone and the thyroid cartilage and the cricoid cartilage, right? And the trachea, and then we had all the vasculature that we did in there, like your common carotid arteries and your jugular veins and all that kind of stuff. All of that is lifted up and off of the cervical vertebrae now. So we're looking at the back of your throat in here. And this is where we're going to zoom in, right in here. All right. So let's move forward a little bit. Let's come down, touch like that. It's just enough so we can still see where the spinal cord was cut. Right? Sorry, just going to move over a little bit. Let's see if we do that. There we go. There. All right, I think that's good. Okay, so we're in the back of the throat now. So let's identify some of this stuff. I grab my other forceps. Okay, so I made an incision back here, and I want you to see that incision first. So you see how we can grab this here and this little bit over here, right? I cut this open right along here. That was all closed up, and you can kind of see where the top of those flaps are up there that I'm moving around. So I made an incision right along the midline down to here. This is where I stopped cutting it, right down there. And what I cut through there is your pharynx. All right, so we opened up this whole area here is your pharynx. Your pharynx is the very back of your throat. So the back wall of your throat is the pharynx. That's where it is. We opened up the back of the pharynx here. All right, so you're going to note that the pharynx has 3 regions. Right? And those regions are going to be nasopharynx, oropharynx, and laryngopharynx. Those are the 3 regions that we can see here in the pharynx. Okay, nasopharynx is going to be the most superior region. Oropharynx is in the middle, and laryngopharynx is below. So if we go from top to bottom, we go nasopharynx, oropharynx, laryngopharynx, and that's this whole area here, three regions. I'm going to show you exactly where those regions are. We have to identify some more stuff, but I just want you to be aware that we're in the region of the pharynx here, and we have 3 subregions in between it. 1, 2, 3. Nasopharynx, oropharynx, laryngopharynx in here. All right, now let's landmark some of this stuff. So we open this up so we can look inside the throat. See, this would normally be closed over. Open this up, right? And what we're going to find first is way up here, and you guys can see it a little bit better. Actually, let me hold that down. I need to just move up a little bit. Let's see. Sorry, just need a different angle because of the way the head is here. Yeah, that's a little bit better. All right, so let's grab this here. Let's see if we can. It's all right. I can just get it right there. Yeah, you see that thing? See this whole flap that I'm moving around here? That whole flap. That is your soft palate. So this whole thing here that I'm moving is your soft palate. Notice how hanging off the end of the soft palate, you see this little dangly thing that I'm moving right there? That little guy hanging down, and I'll just grab it. See this little thing that I'm holding on to there? That's your uvula. That's that little punching bag that hangs down in the back of your throat. Right? So the whole flap here, the whole thing is the soft palate. Hanging off of the soft palate is your uvula, which we got right there. Okay? So that means that right where I am here, imagine if you opened up and said ah, and you saw your uvula, you're in the very back of your mouth. And that's where we are right here. Okay? So we cut open that back wall so we can go in from the posterior side. So you want to be able to identify the soft palate, and then notice that a feature of the soft palate is that uvula that hangs down, right? Come down a little bit. Next feature we find is this kind of bendy flap here. Now I'm going to use my finger. You see how I can kind of, it's pretty springy. I can move this thing around. This is a flap of cartilage, right? And that is called your epiglottis. This flap here is called the epiglottis. All right. What does the epiglottis do? The epiglottis is a cartilage flap that closes this opening here. So you see how I can push the forceps down into there? That opening goes down into your airway. Right? So right now we're going into the airway. And notice that the epiglottis, if it closed, right? If that was able to push down, I can't just because of the position of the body, it's not going to go down all the way, but if that closed, it would close off that opening there. So it would close your airway. That's what the epiglottis does. It closes off your airway. It does that when you swallow, right? If I push the probe through the opening right here into your airway, I'm going through what's called the adytus. The adytus is the inlet or the opening going into your airway there. So here I'm passing through the adytus to get into your airway. And then once we go down in there, the first part of the airway that I'm pushing into here is the larynx. All right, so we got the epiglottis covering the opening, which is the adytus, going into your airway. And if I enter in here, I'm going into the larynx. And if I go farther, if I push way down there, then I'm entering into the trachea. So I'm going through the first part, larynx, and then further in trachea. Also inside there are going to be your vocal folds. All right, the vocal folds are going to be located just inside the larynx on either side, down there. All right, now we come down. Instead of going into the airway, we're going to stay posterior to it. So we're going to go behind the airway here, and we're going to go down, 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 and look at how I can push the probe in there instead. See how it's sitting into a different opening there. That now is going down into your esophagus. So that's where the food would go, right? So air is going to go here. Food, when the epiglottis is closed, the food hits the epiglottis, it scoops back, goes around behind the airway, and goes down into the esophagus, down there. Okay? All right, so how are we going to identify the regions of the pharynx here? All right, there's a couple more things we want to palpate and identify. One is, if you can see here, I don't know how well this shows up, but there's a point. There's a little point sticking up there and a little point sticking up there. Hopefully you can see that shiny bit of light kind of coming off. It's what I'm moving here. Those 2 points are the posterior part of your hyoid bone. So remember, on the front, we had 3 structures that we identified along the anterior neck. Hyoid bone, thyroid cartilage, cricoid cartilage, right? This is the back of the hyoid bone. You can feel that there. That's the back of it, right? Because it's horseshoe shaped. So it's kind of sticking at us like this, and we're feeling the points of the horseshoe like that here, right? Right here, when I'm pushing against here, okay, is the cricoid cartilage along here. And on the sides, down in here, you can't see it, but there's a cartilage ridge going along either side, like right along here and right along there, and that's the back of the thyroid cartilage. Because again, the thyroid cartilage is kind of C-shaped like this. So it wraps around the neck, and it's kind of broad, right? And I'm feeling right there. So we got the hyoid bone up top, then we got thyroid cartilage right here, and then in the middle, this hard spot that we can palpate right here, cricoid cartilage. All right, now, having said that, now we can figure out exactly where the regions are. So what you want to note is that from the soft palate, which again is this whole thing, from the soft palate superiorly. So I'm going to take the probe and I'm going to push it in here above the soft palate. See how I'm going up in there? That's going up into the nasopharynx. That's the very back of your nose. All right? So from the soft palate superiorly, nasopharynx up here. From the end of the soft palate, so right where we got like the uvula, if I can hook around at the uvula and the end of the soft palate, from there down to the epiglottis. And I'm just going to hold the epiglottis down out of the way a little bit. So in between these 2 spots, right where the probe is there. I know it's a little tough to see, but in that area right there. Okay, that's oropharynx. From the end of the soft palate down to the epiglottis, oropharynx. And what are we going to see in the oropharynx? What is this tissue that I'm pushing against right there? That is the very back of your tongue. That's the root of the tongue. Okay. Right down there. That's the root of the tongue, and that's what's in the very back of your mouth in the oropharynx. The laryngopharynx is from the epiglottis down until we get past the cricoid cartilage. So we're going to palpate here, and we can palpate the end of the cricoid cartilage, like right around here, right about there. We can feel the end of it. You can't see it, but you could palpate it if you're in here. From the epiglottis down past the cricoid cartilage, that is laryngopharynx. And then once we get past that, then we stop calling this the pharynx, and we start calling it the esophagus, where I have the probe going in there. All right, so those are all the parts that we need back there. Okay, so this is the upper portion of the digestive system. And we also saw the upper portion of the respiratory system as well. So you're going to know, you swallow a piece of food. You chew it up in your mouth, right? So you're up in the oropharynx here. Chew that up and you swallow it. What happens? Epiglottis closes. That food ball, which is called a bolus, moves past the epiglottis. It has to travel behind the larynx through that laryngopharynx. So it starts off in the oropharynx, travels back behind here past the laryngopharynx. This is the spot where food gets stuck in your throat, because getting past the cricoid cartilage here is the tightest spot. So when you feel like you got something stuck in your throat and you have to swallow a whole bunch of times, it's because the food's right here. It's right behind the cricoid cartilage, right? Then once it passes that spot, then it enters into the esophagus. And then from that point, peristalsis takes over, that rhythmic contracting of your digestive system, and that's going to push that bolus down farther. So we want to see where that goes. So we saw the beginning of the esophagus. Let's follow it down. All right, so let's move over here. And let's put the head back. Let's get this here. Let's get the head back in position. Let's get you back here, nice and easy. There we go. Again, we're just going to prop this up so the head doesn't roll around at all. Okay, so here's the tip of the chin. So the esophagus is going behind all the throat structures here, right? Because we can see like the Adam's apple sticking up and everything. So the esophagus is going down behind all this stuff, right, where we had the probe going in, right? And then it's got to get through the thoracic cavity, okay? In order to do that, the esophagus has to pass through here. So let's open up the thoracic cavity real fast. Let's get this out of here. And let's get these muscles out for a second. All right, and let's open up the pericardial sac. Here's the heart. Let's grab the heart out of here. All right, get that out. And we're looking into the pericardial sac down in there, right? Behind the pericardial sac, and I'm going to grab it right here. I don't know if you guys can see me moving that around. I'm pinching a tube right there. See, I have it, and it's behind the pericardium. That is the esophagus right here. So the esophagus passes through the thoracic cavity by traveling posterior to the pericardial sac behind the heart. All right, right there. It's going down. And then right here, right where I'm grabbing it here, the esophagus is going to go through the diaphragm, right? Which is that muscular dome that separates the thoracic cavity from the abdominal cavity. So there's the top of the diaphragm there. There's a little bit more of the diaphragm there. It's underneath of the pericardium right here. And I have the esophagus, and right there, it goes through the diaphragm, all right? Once it does, enters into the abdominal cavity, the esophagus essentially ends as it passes through the diaphragm, and it starts to open up and get wider, and that's where it becomes the stomach. Okay, so that's the last spot that we'll see the esophagus right there, and then we're going to follow it towards the stomach here. So let's put the heart back, and then let's open up that abdominal cavity, and then we'll follow the esophagus down further. Now, we're going to have to take a detour for a second because there's a bunch of other things we need to identify when we first open up the abdominal cavity, and then we'll get back to the esophagus coming into the stomach. All right, so we just got to be able to identify a couple more things here. So let me just cover this all back up for us so it doesn't get too dry. And then we'll move that down. I have to go get my bungee cords. Just cover back up the face and the skull. Quick. There we go. Just get you in there. Like that. Okay. Now. All right, let's move down a little bit. Something like this, I think. Let's see how that is. All right, so you're going to want to get your, I think, digest 2. Let's see what that one is. Digest 2. Yep, and can you actually put, like, just make it visible on the screen for a second? Okay, so that's digest 2. You're going to want that one so you guys can kind of see what that looks like. And I'll pull them up again in a second when I talk about it, but to kind of get that one ready. And I mean, if you have 3, 4, and 5, get them ready too. But the first one we're going to do is digest 2 and digest 3. Okay, so just take off 2 for a second and put up 3. There's 3. So those are the 2 we're going to talk about a bunch right off the bat. Okay, you can turn that back off for a second. So digest 2 and 3, you want to have access to those. And again, when I first start talking about it, I will throw them back up just so you know which one we're talking about. All right, I need to grab my bungee cords. Where did I put them? Over the sink here. Oh, over there. Never mind. Here, let's grab this guy. Yeah. Oh boy, sore. And this guy. Okay, and you'll see why we need these bungee cords in 1 second. All right, so let's open up the abdominal cavity. So what we're going to do is take this abdominal flap here, that part of the wall, and we're going to reflect it out like that. Then we're going to take this part and we're going to reflect it out like that. And then we're going to take this bottom flap and we're going to pull it down like that. Now we're looking up into that abdominal cavity. Now I might need to mop this out a little bit. Depends on how wet it is. We'll see as we go along. So we've kind of opened this up. Now I'm going to use the bungee cords to lift up on the rib cage because there's a bunch of stuff up underneath here that we won't be able to see unless we really lift this up out of the way. So let's get these guys hooked up. Something like that. And we'll come up this way. That's one side. And let's do the other side here. Here. Like that is good. Get this side in. Might need to move his body up a little bit. Oh, nah, that's fine. It's good, good. All right. Now let's see how much I need to wipe out stuff in here. Let's see here. So we got a little bit back there. That's actually not too bad. Just give me a second and I will explain what you're seeing. I'm just going to dry this off a little bit so it's not quite so wet. It'll just give us a better picture. All right, that's good. Get a little bit more in there. Awesome. It's all pretty good. And a little bit, that's actually not bad. All right, hold on 1 second. Sorry, I'm going to use my turkey baster. Get some of this out of here. And we got any over here. A little bit, but not too bad. Okay. The rest of it, I think we can just kind of wipe up. Sorry, I know this is like a little yucky, but it's just we got to do this to give us a good picture. And unfortunately, when we wet the bodies down, where does all that fluid accumulate? Into the abdominal cavity, because it's kind of sealed in the back here. So there's just nowhere for it to go. So we have to wipe it all out. All right, that's pretty good there. Okay, we're in good shape. That's fine. All right, so what can we see here? Couple things. So you want to note that when we open the abdominal cavity like we did, we cut through all the muscle, obviously, but then we cut through the outer membrane that surrounds the abdominal cavity, and that is called the peritoneum. So remember, we named the membrane surrounding the lungs, we called it pleura. The membrane surrounding the heart was pericardium. Around the abdominal cavity, it's peritoneum. So we can kind of see that here. You see this like whitish, shiny membrane that I'm running my fingers along there? That is peritoneum. You can see an edge of it here, right? This stuff right here, that's peritoneum. So peritoneum surrounds the entire abdominal cavity, and this would all be parietal peritoneum up there. Visceral peritoneum is adhered to and covering all of your viscera, or your organs in here, right? So again, remember we got two layers, parietal and visceral. We're always going to have those two layers. Parietal is more superficial, visceral is deeper, right? So those are the two peritoneal layers. And we cut through parietal peritoneum so we can get in here. All right. Now, next thing you want to note is that once we go into the abdominal cavity from the front, we are in the peritoneal cavity. Peritoneal cavity. Just like if we were in the lungs, we'd be in the pleural cavity. Or we're in the pericardium, we're in the pericardial cavity or the pericardial sac. Right? Here we're in the peritoneal cavity. But what you want to note that's different about the abdomen that we don't have in those other spots is that there is a separate space located posterior to the peritoneal cavity where we are here. There's a space behind it called the retroperitoneal cavity. And I will show you where that is a a little bit later. So you're going to note that right now, the only things that we can see in the abdominal cavity are things that are located in the peritoneal cavity, where we are here. We're not going to be able to see anything that's located in the retroperitoneal cavity. All right? Why? Because the parietal peritoneum is going to be covering it up. Right? So the parietal peritoneum goes around the abdominal cavity like this, right? Surrounds it. But on the back side, there's space behind it. So we got parietal peritoneum, and then there's stuff posterior to the parietal peritoneum. Again, that's retroperitoneal. We will not see any retroperitoneal things today, but I will describe where it's going to be. And if you're confused now, as we go through, hopefully it's going to start making more and more sense, right? You need the whole picture to be able to understand exactly what you're seeing here. All right. So we're in this peritoneal cavity. Now, next thing is let's arrange this stuff so it would look the way it's supposed to look, all right? Which means that this here is going to get dragged down like that, okay? And notice you see all this yellowish tissue. See all this stuff that I'm grabbing here? That's all fatty tissue. And notice how it's like a blanket, see? Just kind of lays down over everything else. All this fatty tissue that you're seeing here that you see kind of covers up everything, that is called omentum. Omentum. There's two different types of omentum here. Greater omentum, lesser omentum, those two, right? Greater omentum is this whole part that we have here, all this. This is all greater omentum, all the stuff that I'm moving here, all along here. Now, if we follow the greater omentum up, so we have the greater omentum, we're going to follow it up this way. Notice how we run into this thing here. See this? That's your stomach. And notice how the stomach's not covered by this stuff. No omentum over the top of the stomach. So we have greater omentum going up to the stomach here, right? Then we got the stomach. And then up in here, up in this area, see all this fatty tissue that I'm moving around right there? That's lesser omentum, all that stuff. And the lesser omentum is located in between the stomach and this thing that I'm lifting up here, which is the liver. All right, so taking up the space in between the stomach and the liver there, lesser omentum. But notice that that does not cover the stomach either. So let's throw up digest 3 real fast. And if you look at digest 3, you will see exactly what I was just talking about. Right? So there we got a picture of the stomach. And we're going to go over the parts of the stomach in a second. But notice we got a picture of the stomach. And on either side of the stomach, we have greater and lesser omentum. All right? So if you guys are seeing that, you should be able to see the omentum. You should see how it goes up to the stomach but doesn't cover over the top of the stomach. Right? So if you have, excuse me again, if you have that drawing out and handy while I'm talking about this next part, you're going to be able to follow along a little bit better. Okay? So we're going to take that picture off, but again, if you can have that one up, and again, that's digest 3, that's going to help you out a little bit in this spot. Okay, so this is what we see when we open up the abdominal cavity initially. We open it up, we look, we see greater omentum, we see the stomach, we see the lesser omentum, we can see the liver down there, and we'll get to more of the stuff that's up in there in a second, but that's basically what we can see. If we don't move anything out of the way, there's not much else that you can see. Now, obviously, we can take that omentum and see we can reflect it, and that uncovers other things underneath there. But for now, let's assume that the greater omentum is down. Everything's down. You can see greater omentum, stomach, lesser omentum, liver. That's it. Okay? So, let's just go over the parts of that drawing that you guys have out now, and we'll do the parts of the stomach. So we said that the esophagus was coming down behind the heart through the diaphragm. Right? And right here, I'm pushing up against. That's the underside of the diaphragm that I'm pushing up against. So the esophagus is going to come through there. And when it does, it starts to widen. And that's where it becomes the cardiac region of the stomach. All right, which is on that drawing there. Cardiac region of the stomach. That's the first part. And that's where the esophagus is kind of opening up. Becomes the cardiac region of the stomach. Now, that is located way up underneath here. You're not going to see the cardiac region too well because it's up there pretty far. Okay, but what we will see is the next part of the stomach, which is most of what you're seeing right here, which is the body of the stomach. And that's on that drawing too, right? So you got cardiac region going into the body of the stomach. And then the body of the stomach, and hopefully you guys can see right here, see how this is narrowing right here? See how the stomach is wide here, but then it's narrowing, right? This portion where it gets skinnier or thinner, that is the pyloric region of the stomach. And then the pyloric region ends right here. I'm pinching a mass, right? A firm mass right at the end of the stomach, and that is the pyloric sphincter. It's actually a really big ball of muscle here located at the end of the stomach. Pyloric sphincter. And that marks the end of the stomach, beginning of the small intestines. And again, that's on your drawing. So if we come down to the stomach, you're going to have cardiac region of the stomach, which you're not going to see. We're going to have the body of the stomach, which we can see here. And then we're going to have the pyloric region where it's shrinking down right there, ending at that pyloric sphincter. Okay, so again, if I was going to ask this, I kind of spread this out like that. I would say, in this area, I want you to identify this whole thing, right? Specifically, this part of it, which is the second part, right? That would be the body. If I said identify this, and I want you to identify the part that you can't see up there, the first part, you take cardiac region, right? If I said I want you to identify this whole thing, I'm outlining the stomach, and I want you to identify the third part of it, which is right here, you'd say pyloric region, right? So as long as you know you're looking at the stomach, I would say what part of it I want you to identify. I'd be pretty clear so you know what you need to answer there. Now, what else can we see here? We have the borders of the stomach. This side of the stomach, you can see labeled on your drawing, is called the greater curve of the stomach. That side up there is the lesser curve of the stomach, right? Notice that the greater omentum goes up to and attaches along the greater curve of the stomach. The lesser omentum up here goes up to and attaches along the lesser curve of the stomach. All right, so the names match up there. All right, and then we said once we get past the pyloric sphincter, we go down into the first part of the small intestines, which is the duodenum, which we'll revisit in a second. So we're going to come back to the pyloric sphincter and follow this further down in just a second. All right, what else can we see here? One thing on that drawing is if you look in the upper left-hand side of that drawing, up over here, basically up around the body and the cardiac region of the stomach up over here is where the spleen is. Now, in order to see the spleen, I need to like push it up a little bit. So let's get back up into here and reach up into the thoracic cavity. And I'm pushing down through the diaphragm, and I'm going to grab the spleen, and I'm going to push the spleen up so we can see it here. And that is right there. Can you see that, Alex? I can't see it in the camera. So this whole thing, that's the spleen, right? And the spleen is the most upper left-hand thing that we have. And as soon as I let this go, it's going to fall back in there, but you can see it. I got to kind of lift it up by pushing through the diaphragm from the thoracic cavity. All right, so I'm going to let that go. So that's a spleen. We can see that. But again, you have to manipulate things a little bit to be able to get to that. The other thing that we can see, right, is going to be the liver. And for this, you're going to want to pull up digest 2. Right, and that'll give you the liver and the parts of the liver. So we'll leave that up on the screen for a second so everybody can see it. But if you're looking here, you see on digest 2, you got a picture of the liver, right? And this will be the parts of the liver that we can see, which are going to be the left lobe of the liver, the right lobe of the liver. You see that there's a blue line in the middle in a membrane, right? And that's going to be the round ligament of the liver, or the what's left over of your umbilical vein. And then there's going to be attached to that, you can see those lines there that I drew in the middle. It shows you like a membrane. That's the falciform ligament. So we got a couple things we need to see there, right? So we'll take that off, but I'll be talking about that if you want to leave it up. And here, what we're going to do is we're going to zoom in a little like that so we can see. This is not where I want it to be. Hold on. That's better? Yeah, that's better. There we go. All right. So we're looking way up over here on the upper right-hand side. Okay. And you can see right here that this is the left lobe of the liver, this part. Right lobe of the liver is that part there. So you see this little split right there, right lobe, left lobe, because I'm standing on the left side, so I'm looking in on the left. So this is left, that's the right. Notice, here's that blue thing that I highlighted on the drawing. It's a tube, right? This is what's left of your umbilical vein. So this is part of your umbilical cord. This is an adult, right? We call this the remnant umbilical vein because the tube is still there, but it's just not used for anything anymore. And that's right here. And notice, where does that umbilical vein go? It connects up here. This flap, the one that we moved over, is the one that had the belly button. So if we follow this up here to where the bungee is over there, that's the umbilicus, or the belly button. That would have been right in the middle down here, right? That umbilical vein goes through the umbilicus, down, 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 and what does it do? See how it goes right down and enters into the liver right there. That's where blood entering into the fetal circulation enters in through the umbilical vein, which would be that, and goes into the liver. If you guys look back later on, I'm going to tell you now so that when you listen to this later on, you can have it up. Grab back out that heart circulation flow chart, and you will see that if you follow the umbilical or the fetal circulation, that you're going to see umbilical vein going in through the umbilicus and into the liver, and that's what we're seeing right there. All right. Now, so we call this the remnant umbilical vein. The other name for it is the round ligament of the uterus. No, I'm sorry, the round ligament of the liver. Sorry, round ligament of the liver. And that's just another name for the remnant umbilical vein. So that's that. Now notice, this is the tube that my finger is behind, but if I push my finger back farther, you see how you can see the tube now, plus you can see this transparent membrane right next to it. Right, that's showing up pretty good right now. And that membrane that I'm behind, that's the falciform ligament. So you're going to note that the round ligament of the liver or the umbilical vein is embedded within the falciform ligament there, which is that membrane. So if I had this like this, I'd either say identify what this tube is called right here or identify what the membrane is called there. And that's how you'd know whether you're asking about the remnant umbilical vein or the falciform ligament. All right, what does the falciform ligament do? The falciform ligament is a suspensory ligament. It holds the liver up against the diaphragm and suspends it from the bottom of the diaphragm. That way, when you stand or sit up, right, your liver doesn't drop. If it wasn't for the falciform ligament, every time you stood up, you'd feel this whole giant liver here drop in your abdominal cavity. It doesn't because it's held in place by that falciform ligament. Holds it up. Okay? So we can see that. Now, let's lift up on the liver. And I'm going to go to the other side here. And if we lift up on the liver, you can see that there, Alex? Or is the camera no good there? Is that all right? So if you guys look here, you see this green sac that I'm moving around a little bit. And it's hard for me I got to hold everything out of the way and try to move that. But you see that green sac there? That's the gallbladder. And the gallbladder is located on the underside of the right lobe of the liver. All right, let me just mop this out again. So we've got a bunch of fluid over here. Just get that, dry this up a little bit. All right, so if you have the gallbladder, you're not going to be able to miss it because it's a green sac, which we can see right there, and it's located on the underside of the right lobe of the liver. So if we lift up the right lobe and you don't see that green sac, that just means that they had their gallbladder removed. Okay, but he's got nice gallbladder there. We can see it, no problem. Good picture. That's it. All right. And then you also see on your drawing the caudate lobe of the liver. You see that a little lower down in the drawing? And that is covered up. It's behind the lesser omentum there, so it's a little covered up in this area. So you're not going to see that just yet. Next week, next lab, we'll be able to see that a little bit better. Okay, so we can get to all that stuff. All right, now let's go back to the digestive system. So we wanted to see all the stuff that we could see around the stomach there. Now we're going to follow down a little farther. So we said we went down, and you can bring back up digest 3 for this, so you can see this part. We're going to move the camera just a touch. And hopefully we can highlight this. Hopefully I get the camera in the right spot so we can see this well. All right, so we're going to just get a little bit more of a bird's eye view of this area. Yeah, that's pretty good. So it's almost like I'm kind of leaning over. I'm still standing on the left, and I'm kind of leaning over and looking down on top of the body here. Right? So let's spread this out. So you see the stomach pretty well there. Right? Here's the body. Sorry, no, it's wobbling just a touch. There we go. There's the pyloric region. There's the pyloric sphincter. All right, now look here. You see if I grab the pyloric sphincter, you see this tube going down that way. That's the duodenum. That's the beginning of your small intestine. All right, so again, if we're on the pyloric sphincter, that is the separation between the stomach and the small intestine right here. All right, separates the pyloric region of the stomach from the first part of the duodenum. All right, now what you want to see here, and this is what your drawing is showing you. So if you're looking at that Digest 3 drawing, you see the stomach, pyloric sphincter, you see the beginning of the duodenum, and then it loops down, and I show it passing through a membrane, right? And I have a letter A there on the drawing, right? That's where we are right here. From here, going down, this is going down towards that letter A, and we're passing through a membrane. So what you want to know is that the duodenum has 3 parts, okay? This part, first part, is descending duodenum. Why? Because it's going from anterior to posterior. It's diving deeper into the abdominal cavity, descending duodenum. The descending duodenum passes through the parietal peritoneum, becomes retroperitoneal. On that drawing, that's right where that letter A is, and that's where it's passing through the membrane. I have it labeled parietal peritoneum, and then I have it dotted past that spot because it's retroperitoneal and you're not going to be able to see it. All right. Then that'll be the retroperitoneal part is horizontal duodenum. That stays retroperitoneal. And then the horizontal duodenum will come back in to the peritoneal cavity again and become peritoneal, and that'll be ascending duodenum. So the duodenum does a 360. It starts here, it goes down on the right, crosses over to the left, and comes up on the left. So it goes all the way one full 360, right? Descending, horizontal, ascending. Those are the 3 parts. All right. In this position, where we are right now, with the greater omentum down, we can see the stomach, we can see the pyloric sphincter. That's where we're going to be able to see descending duodenum, which is what we have here. So I'm going to lift the liver up out of the way. There's that descending duodenum. And look right here. You see right, if I can get it, right where my finger is going under. See that? You see how my finger is lifting up a membrane there a little bit? We can see that, right, Alex? At least a little. That is where we're going retroperitoneal. So my finger is going into the retroperitoneal space. Now, I made a little incision here so I could get my finger behind there. Typically, we wouldn't be able to do that. But notice how the duodenum is passing through where my finger is. So descending duodenum goes through the peritoneum right there. And again, you can see the edge of the peritoneum. See where I cut it? Right there. See? This is going through that, becomes retroperitoneal. That's where we have horizontal duodenum. We won't be able to see that this week. I'm going to show you where it would be, but you won't be able to see it. We need to find where the duodenum enters back into the peritoneal cavity. That's the next picture we want to find. To do that, though, we have to identify a couple things. So I know there's a little stop and go. This is definitely something where you're going to want to listen now, then you're going to go back and you're going to listen to this and fast forward a couple times so you can get it down, especially with the drawings. If you do it 2-3 times, quickly go through it, just listen to these couple parts, you will have this down and you'll be no problem. But please understand that the first time, this might be confusing. All right, so it's okay if you're a little not sure. Pay attention to the landmarks that I'm showing you. Like in this area, I'm telling you that the greater omentum is down, that the stomach is down, we can see it, and we're looking for that pyloric sphincter, which we can see pretty easily. And then you can kind of locate things around that. That's what you want here. All right, let me zoom back out a bit. Let's get up here, come back out again. So we zoom back out. Now what we're going to do is we're going to reflect the greater omentum. So we're going to take, boy, Alex, are you sweating to death? It's hot in here. Holy mackerel. It's really hot in here. It's nice and cool out in the hallway. It doesn't really help. We did it yesterday. It didn't matter. All right, so we're going to take the greater omentum and we're going to reflect it. Actually, you know what? Maybe we'll try. There's a, if you want to grab that side, there's that little bucket or whatever. Just wedge that, put it in the door so it doesn't close all the way. Sorry, guys, we're just going to pause for 1 second. We're going to try to get a little airflow in here because it is super duper duper hot in here, and I have like sweat pouring down my face. Sorry. 1 second. Whew. All right. See if that helps at all. A little airflow in here. Okay, so we reflected the greater omentum. That's up now, right? When we do that, and I'm going to hold up the greater omentum a little bit like this, right? And you can see, hopefully, see this tube. See right there? Here's the omentum, right? You can see that tube there. See, I'm kind of tugging on it there. That is part of your large intestine that we just uncovered, and that is the transverse colon, all right? So what you want to see here is go to digest 4, I believe. Let's pull that one up for a second. 5, maybe. Go to 5. Yeah. So we're throwing up digest 5. We're going to have to go back and forth between digest 4 and digest 5. And you're going to want to look at both of those things, you know, as we're going through this next part. So you look at digest 5 and notice that what I'm showing you is the greater omentum reflected, okay? Yeah, so just leave that up for a second. So you can see the greater omentum. I say it's reflected. You're looking at the underside. And then that tube that I just highlighted is that transverse colon. I'm going to show it to you again. Okay, and notice when we lift that up, that's when we see the rest of the intestine. So you can see the rest of the colon going around the perimeter, and then in between, I got those small little squiggles in there, and that's the second and third part of the small intestines, which is the jejunum and the ileum. Now we're gonna put up these things. You're gonna see all this stuff, but just know that right now we're looking at digest 5. It's kind of where we're starting, and then we're gonna go to digest 4. Okay, all right. So you can take that one off for a second. And again, so over here, holding up that greater omentum, so that's where I'm reflecting it. Your picture is showing it held up. So we got greater omentum. Here's that transverse colon. That's kind of what I'm grabbing right along here. It's adhered to the underside of the omentum there, right? So we're going to leave this up out of the way as best we can. It's not going to want to stay up there, but hopefully it'll stay decently. All right, so we're going to leave that greater omentum up there. Then what do we uncover? Down here, we uncovered the rest of the intestines. So what you're going to note is that, and I'm going to need to just clamp this up here, I think, because it's not going to stay otherwise. Hold on a second. What can I clamp it to? Something like that. Keep it up. Just gonna, oh, that didn't work. Try that again. Something like that. Get this up out of the way. Huh? Is it? Are you feeling it? Yeah. Okay, good. It's not going to stay. Hopefully that'll just not completely fall down on top of us here. Everything wants to like ooze back in. We're trying to hold that greater omentum up. Now, in this area, what we're going to see, yeah, you see it just doesn't want to go, are the rest of the intestines. So you're going to note that the large intestine, which is all this that I'm holding up here and over here, this is all large. This is going to be around the perimeter of the abdominal cavity. And everything that's in the middle, right, all of this stuff that I'm going to hold up here, this is all small intestines. All right, and I know when it's like that, you go, oh my God, how am I ever going to realize the difference between all of this stuff? And the answer is when it's like this, I'm not exactly sure what the heck I'm looking at, right? I need to arrange this in particular ways, and that's going to really show you where you're at. Okay, so this is where we're going to go to the other digest one. Was it digest 4? Now let's throw that one up on the screen. All right, and again, like I said, this is a little confusing the first time because we got to lay out some ground rules here, and you'll know where you're at. All right, so digest 4, you can just leave it there, it's fine. This is a continuation of digest 2. So you can see that letter A again, which is the descending duodenum. You can see where the descending duodenum passes through the parietal peritoneum. You can see the dotted part, which is the horizontal duodenum, which is retroperitoneal, it's labeled, right? And then you can see where the horizontal part comes back through the parietal peritoneum and becomes the ascending duodenum, all right? So we already saw descending. We saw where the letter A was. That was on the other drawing. This is just to show you how the drawings connect. Now we want to see this part. We want to see where is the horizontal duodenum and where does it emerge to become ascending duodenum. And then notice the bottom of that drawing, we have a thing called the root of the mesentery. And that is what the horizontal duodenum is behind, the root of the mesentery. So this is the picture we need to find. All right, so what we're going to do, I'm standing on the left-hand side. All right. I am going to take all of the small intestines and I'm going to move them over to the right as far as I can. Okay, so let's do that. So we're going to grab all the small intestines, and I'm going to get these things up and out of the body as much as I can. Up and out, all this stuff up and out of there as much as we can. Let that all drape over to the right-hand side, like that. All right? Now, all the small intestines are all up and out over there. Now, this is normal. We could do this to anybody. That's normal intestine mobility there. Right? We can take all this stuff and move it over as far as we can. What do we expose here? See right here see how I can get my finger kind of behind this here to about right here? This is what we call the root of the mesentery. What is mesentery? Let's pull back one of these guys. See? Like this. See this yellowish tissue here that my fingers are behind? That's all mesentery. And notice how your intestines, see I'm holding small intestines here, that they are all attached to the mesentery. See? All this yellowish tissue, mesentery, and all your small intestines are all attached to it, right? The root of the mesentery is where all of this fatty tissue that your intestines are connected to, where is it anchored? And that's going to be right there. So see if I grab all this stuff and I try to pull it, right? See how we're tugging along this line here? And that's because the mesentery is anchored there. Now, next time, when you see this picture next time, I'm going to have cut the root of the mesentery right here, which is going to allow us to take this stuff and really just move it up and out of the body a bunch more than we can now. Right now, we can't because the root's preventing it. Now, that part of the horizontal duodenum is behind this. We can't see it because it's underneath the root. But what can we see? Right here. See this part? That. Notice how this is kind of just emerging. Looks like it's coming out of nowhere. That is ascending duodenum emerging from underneath of the root of the mesentery. And that should match up to your picture a little bit. Right? So we got here. We moved all the small intestines. I would say this on the practical. So I'm going to take all this stuff and I'm going to move it over there. We can see this part here where all that would be anchored down. That's where I'd be showing you the root. And then I'd say I want you to identify this part right here, which is emerging from underneath of this. And you'd say that is ascending duodenum. Okay? And then next thing you want to find is see how I'm still grabbing the duodenum. See, I'm trying to, not the duodenum, I'm grabbing the small intestines here. So there's ascending duodenum. Notice how it's anchored right there. See that spot that I'm pulling on? Right here. This is called the jejunal flexure. And it's just another spot where the intestines are pinned down right there. You see how if I try to pull on that spot, I can't move it, right? So ascending duodenum, jejunal flexure. That means that this part now that I'm holding up here is the jejunum. So we're going to use that jejunal flexure right here to mark a name change between the end of the duodenum, ascending duodenum, beginning of the second part of the intestines, which is the jejunum. And that'll happen right on that jejunal flexure. All right, so a bunch of things happening in this picture. You see me arrange things this way. You know you're seeing the root. The root will allow you to find that last part of the duodenum. You'll also be able to find that flexure right here that marks the name change between duodenum and jejunum, and then also the beginning of the jejunum. So lots of stuff there. You really need to know this particular picture. Okay? Now, let's follow the jejunum. Now, we know that the second two parts of the small intestines are jejunum, ileum. Those are the next two parts, right? But the problem is how do we tell the difference between the jejunum and the ileum? All right, so let's move some of the small intestines back in. So we see we got all small intestines here, okay? I'll bring all this back in, all that small intestines, right? And we're going to go, well, we have a loop of small intestines here, right? We can see that. Let's just kind of lay that loop up there like that. And let's grab another loop down here. Let's kind of lay that guy out like that. But hopefully you guys can see a loop of intestine there, and you can see a loop of intestine there. How in the world are you going to know if this is the jejunum? If that's the jejunum? Is this the ileum? Is this the ileum? The answer is there's no way for you to tell, right? Because they look exactly the same on the outside. So between all these loops of intestines in here, I go, well, what loop is this? What's this here? No idea. I don't know in the position that I'm in right now. Why? Because it all looks the same. So there's no external way for you to tell whether you're looking at the ilium or the jejunum, right? And there is no landmark that's going to tell us where we switch over from jejunum to ilium. There's no way for us to know. So don't worry about that. All right. What you are going to pay attention to is if we were at the jejunal flexure like we just were, we know for sure that just past the jejunal flexure, that's definitely jejunum. We know that for sure, right? And if we go all the way to the end of the small intestines to where the ilium is going to join with the large intestine, that spot we're also going to be able to identify. And then we'll know for sure we're on the ilium. So we're only going to know by being at the very beginning of the jejunum or at the very end of the ilium. That's the only way we can know for sure. If we're in between those two spots, then we're taking a guess. All right, so let's do this. Let's put all the intestines back over like we had it, right? So we come over here, everything back out. Lift all this up, get all that up and out like that. So this is right back where we were. So again, I'm grabbing this. There's the root of, sorry, let me get that out a little bit more. There's the root of the mesentery there. That was what we were getting behind before, right? There's the root of the mesentery. Here's the ascending duodenum, jejunal flexure, jejunum. So I know right here, if I'm grabbing this part, I know this is jejunum because I'm past the jejunal flexure. Now let's follow this. So I'm going to grab the jejunum, and we're just going to go through. We're going to go, okay, let's grab this. We're just going to follow it. Follow it. Keep on going. Now, at some point as I'm doing this, I'm going to switch over to the ilium. I don't know where that's going to be because there's no landmark to tell us, right? But we're going to follow this all the way in. So I'm just following the intestines. Now I'm probably into the ilium now, right? At some point I switched over to the ilium. I don't know exactly where that is, but I'm still following. See, I'm just pulling intestines back in, following. And again, you see every bit that I'm pulling through looks exactly the same, right? There's no way to tell. And then eventually we're going to go, and we're going to get to the end. All right, we'll get there in just a second. I'm still pulling. Keep on going right here. Now we're pulling out something a little bit bigger. And look at this picture here. You can see this here. All right, so we got a small tube going into a much bigger tube. See this big thing here? That is the end of the small intestine joining with the beginning of the large intestine. So I know for sure then that this part that I'm holding here is definitely the ilium because I'm at the very end. You can see very clearly something small joining into something big, and it forms like a T, like this, all right? So pull back up digest 5. Yeah, digest 5. All right, put that back up on the screen for a second. So look back at digest 5, and that's up on the screen again for a second. And notice that if you follow those squiggly lines in the middle around to the ilium, and look at where the ilium joins the cecum, which is the beginning of the large intestine. And you see how that makes like a T there. And you can see there's like a red line dividing those two spots. That's the picture we're looking at right now. Okay? All right, so you can take that back off. Right? And that picture was this right here, where this is coming over. That red line is right there. And then this part right here is the cecum. Right? So we see how those two things are coming together like that. So we got ilium. That red line is the Ileocecal Sphincter, which is what separates the ilium from the cecum, which is the first part of the large intestines. Ileocecal Sphincter. You're not going to be able to see it, but it's right at the junction right here. So if I said, we have this spot, right? We got these two things here. We got this part ending, this part beginning. I want to know what separates those two things right there. That's where you'd say Ileocecal Sphincter. Okay. So notice that, see how this is the bottom of the cecum right here, okay? You see how it's just kind of rounded like that. The large intestine is going up this way, so it continues up here. This is all large intestine. You see how I'm kind of grabbing this. This is all large intestine there, right? And the large intestine on this side of your body, on the right-hand side, has two names. Cecum, ascending colon. What's the difference? You have to see where the ilium joins. So I'm going to lay a probe down over the large intestine in line with the ilium like that, right? And you see that's going to divide these two parts. This part from the ilium down here, cecum. From where the ilium joins up that way, ascending colon, which means all this that I'm grabbing here is all ascending colon. Where's the division? Again, an imaginary line where the ileum joins the large intestine. From there down cecum, from there up ascending colon. Okay. Note that there's no break inside. The intestines inside is just one big open tube, right? We're just making an imaginary dotted line right there to divide those two regions. Now, on your drawing, if you look at the cecum, you'll see hanging down at the junction between the ileum and the cecum is the appendix. All right. We have a wonderful example of the appendix on this particular body. Probably one of the cleanest, best ones we've ever seen, and also one of the longest ones. So the appendix looks like an earthworm. When we see it, it's going to look like a little earthworm, and it's hanging down in between these two things. Now, to see it, what we need to do is just reflect this. We need to look on the underside of these two. So we're going to take this, we're going to move it over like that. And you see that? See this long thing? Looks just like an earthworm there, right? Isn't that a great picture?
Yeah.
Look at how big that thing is. Right there. That's the appendix. And look, it's right, here's the cecum, there's the ileum. See if I do this, see it's like that? Come over this way and you can see right at the junction between those two things hanging down there, and I'll kind of get the whole thing out there for you so you can really see all of it. That's the appendix. All right. Now that is a long appendix, much longer than most of the ones we see. That doesn't matter. It's not good, bad, anything. This is a perfectly healthy appendix. There's nothing wrong with it. But that's a particularly long one and like a really, really clear one. We usually don't get one that's like quite that clear and stands out that much. So it's just a really nice picture for you guys. All right. That's the appendix. All right. Now we're going to follow the large intestine. So we had the ileum to the ileocecal sphincter, to the cecum, to the ascending colon, up this way. Now the ascending colon is going to turn. It goes up on the right-hand side, and it turns to go over towards the left. And at that turn is where we're going to change names. So instead of ascending colon, we're going to call it transverse colon. And that's going to happen right down in here, right about there, right? We can kind of see it changing direction there, right? So ascending colon, and then after it changes direction, transverse colon that way. So again, if I was going to say this, I would start here so you know where you are. Go starting here, right here. This ends, this begins, we follow this up, 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 and then it turns. And I want to know what it's called after it turns along here. I want to know what it's called along here. That would be transverse colon, okay? Notice that where it turns, there's another flexure, and that's on your drawing there. And that's going to be the hepatic flexure. Why? Because anything, the liver's up on the upper right-hand side. And anything has to do with the liver is hepatic, so we name this flexure, the spot where the intestines are pinned down, hepatic flexure, since the liver's over there. Okay? And I had to disturb that. A lot of times this gets broken when I'm moving around other things. So it's not still attached to that posterior wall, but it would be, right? So the hepatic flexure would hold this part down so that we wouldn't be able to move that out of the way. All right? Now, we follow the horizontal or transverse colon over this way towards the left, and then it's going to turn and go inferiorly. And that's where we'll start calling it descending colon. All right, so for this, I'm going to get all the small intestines back out of the way. So I'm going to move all the small intestines back over as if we were going to look at the root of the mesentery, right? So I get all this back over, all that out of the way like that. So all the intestines back over to the right-hand side. And here, let's get this. Oh, we got a little bit of fluid in here. Hold on a second. Let me see if I can empty this out a little bit. Just the turkey baster. And then some paper towels. Hold on one second, just a little wet in here. I want to just dry it out, touch. So it's not so wet. 1 second. We're getting there, guys. I know it's a lot of stuff today, all right? You're going to want to go through this a couple times for sure. Okay, good enough. There we go. All right, so if I move this over a little bit, here's the transverse colon. I'm grabbing transverse colon, grabbing transverse colon. You see right there. See this spot? That's the next flexure that you get to, and this is called the splenic flexure. Why? Because the spleen is on the upper left-hand side of the abdominal cavity. So we can see splenic flexure. And that's right, we're going to stop calling this. If I kind of grab it, oh, God, I can't. It's just flopping out of the way, sorry. If I kind of grab it like that, this is where this goes this way and then turns that way. So makes a L shape there, and that's where we got that splenic flexure. So this part here is transverse colon still, and then right there going down that way. From here down, descending colon, which you can see coming down along the left-hand side. Right? So that's all descending colon, descending colon, descending colon, still descending. Right? And then right here, let's get this up and out of the way. Let's get this up and out of here. All right, you see another turn there. See that? Where we go down, and then we turn medially, like that. Descending colon, this spot where we're stuck right here, sigmoidal flexure, and then past this spot, all this sigmoid colon. All right, and then we follow the sigmoid colon. You can see the sigmoid colon is pretty large. See how much, and it all will eventually, it's going to fall down. So the sigmoid colon is going to be way down in there. But you can see that we can pull and stretch this out. See that the sigmoid colon is rather large on him. Right? So right here, this is still descending colon. Then we hit that sigmoidal flexure, sigmoid colon, all of that there. All of this. And that goes down, down, down. Let's get this up out of the way. And the sigmoid colon is going to drop. See, it goes way down there into the bottom of the pelvis. And then the sigmoid colon is going to hit the posterior pelvic floor way down there. And it's going to turn and go inferiorly. So it goes down and that way. It makes an L like that. Posterior, inferior. And when it turns, that's when we stop calling this sigmoid colon and we start calling it the rectum down there. But you're not going to see it. It's happening way down in there. Way down. See where my fingers are going? Not the best picture, but see where my fingers are going there? That's going to be the rectum down that way. You're not going to see it. Okay, so you can see sigmoid down pretty much all the way. You can see sigmoid, me pulling on it. Hits the posterior pelvic floor, turns, becomes the rectum. And then the rectum is going to go down this way, and we're going to run into two sphincters down there. Internal anal sphincter, external anal sphincter, right? Internal one is involuntary, the external one's voluntary, and then we would be at the anus, and then we'd be at the end of the digestive system. Okay? So that takes us all the way through. And you're going to want to watch this a couple of times so that you can figure out what you're looking at. Pay attention to positioning. Where is the greater omentum? Is it down? Is it up? That shows us certain things. Where are the small intestines? Are they all the way over to the right? Or all the way over to the left? If they're all the way over to the right, then we're seeing like root of the mesentery, we're seeing the ascending colon, jejunal flexure, that type of stuff. If the small intestines are all the way over to the left-hand side, then we're seeing the ileum where it joins the cecum and the appendix and stuff like that, right? So again, pay attention to the positioning. And I will always show you, I can't name names, but I will say, okay, you see we take this and we moved it over there. We took this and we moved it over here. You see here, we got the end of this thing coming to the beginning of that thing. You know, and I will give you some sort of landmarking so you kind of know where you are. I'm going to orient you a little bit. And then you're going to go, oh, okay, I know where we are now. Now I know what I can see. That's very important in the thoracic, in the abdominal cavity. Where are things positioned? And when they're positioned that way, what does it allow you to see? Those are the questions you want to ask. A lot of spatial stuff going on in here. All right, so take your time with it. Go over it a bunch of times. All right, what else can we do? We're just about done. So everything else pretty much is retroperitoneal, meaning all of the vasculature, all the arteries and veins and nerves in the abdominal cavity, they're all retroperitoneal. We will not see them till next time. Kidneys are retroperitoneal. Pancreas is retroperitoneal. We will see all those things next time. All right. But one other thing we can see for now, and I'm going to show you where some of these other things are located, is we can see the bladder. We're just going to turn. Right now I'm looking in on the left like this. I'm going to rotate the camera so we're going to look down on the left instead. So we're just going to turn, loosen this up a little bit, and we're going to turn this way. Now we're looking down into the abdominal cavity, into the bottom of it, right? So we get that sigmoid colon again would normally sit down there. So we just get the sigmoid colon up out of the way. We're looking here. And you see what I'm pushing on right here. See this kind of mound that I'm moving around there? That is part of the bladder. All right, so let's grab this a little bit and see we can kind of see how I can kind of stretch out the bladder there, and I kind of let it go. You can see it kind of falls back down. All right, so all this down there, this is all the bladder. All right, now next time I'm going to open up an opening into the bladder so we can look inside of it, but it's right up against there. So right up behind, here's the pubis bone right here. So right behind the pubis bone, all that there is the bladder. Now, we're on a male cadaver. So we have pubis bone, then the bladder, and then down here, see where, can I get this, where I'm hooking my finger underneath right there, right down in there, that's where the prostate gland is going to be, buried way deep down in there. So behind the bladder there, and in front of the rectum, right? So here was that sigmoid colon coming down here, right? So the sigmoid colon goes down, it turns, and it goes under that lip right there. And when it passes under there, in between those two things is where the prostate gland is. Not anything you're going to be able to see because it's very fatty. You're not going to be able to see the edges of it or anything like that. But if we were looking at the female cadaver, this area is where we'd have the uterus and the ovaries would be right down in here, would be the uterus and the ovaries. So I will put up a link to one of our videos of the abdominal cavity from the spring semester, and I'll put a timestamp on it so if you want to see what the uterus and the ovaries look like, you can see that. All right, but since we only have a male cadaver this semester, I can't show it to you live. All right, so I'll have to pull it off a recording, but I will add that to the announcements, and I'll put the timestamp on there. All right, if we want to see where the kidneys would be, and again, we can't see the kidneys, but I can show you where they would be. All right, so we come back, so I'm still looking in on the left here, right? And let's move this back down out of the way. And see, we got this is all, that was part of the sigmoid colon. Here's the descending colon, right? And right in here, right there, this thing that I'm moving, see that? That I'm moving out of the way there? That's one of the kidneys, right there. But notice it's covered up, right? There's tissue over the top of it. Why? Because it's retroperitoneal. So we have peritoneum covering the kidney there. And that kidney is retroperitoneal. So next time I'm going to peel away this peritoneum and you're going to see the kidney right there. Now, if we want to get to the other kidney, we'd have to take all the small intestines, all this stuff, and move it over this way and go to the same spot on the other side. So behind all this stuff over there, again, retroperitoneal. So we'll see the kidneys next time. So let's get the small intestines back in like this. Let's move the greater omentum back down like this, right? So we can see the stomach again. And the last retroperitoneal thing, again, you can't see it, but I'm going to tell you where you would look, is the pancreas, okay? So if you want to envision where the pancreas is, we find the stomach, we follow the stomach over until we see that mound right there, the pyloric sphincter. So we're going to put a finger on the pyloric sphincter, and then we're going to put a finger over here pointing towards the spleen. Okay, remember the spleen was way upper left, but behind all this stuff, right? We moved it out before. But the spleen's back there. I'm kind of pointing to the spleen. My finger's on the pyloric sphincter. And the pancreas is in between those two spots behind the stomach. So we're going to put the probe down like this. That's where the pancreas is. So from the pyloric sphincter over towards the spleen, that way behind the stomach. So next time we're going to be able to move the stomach out of the way, and when we do that, we'll uncover the pancreas. So the head of the pancreas is actually attached right past the pyloric sphincter onto the descending duodenum, and the tail of the spleen, tail of the pancreas, head of the pancreas is attached right at the descending duodenum, tail points towards the spleen. It doesn't connect to it, but it points towards it, just the way the probe is right now. That would be pancreas. Okay, that is it for today. Fair amount of stuff. Go over it a couple times. On Wednesday, we will finish up the abdominal cavity and do all of the vasculature, of which there's a fair amount. So you're going to want to have the abdominal vasculature drawings handy, all right, for Wednesday. And then on Monday of next week is when we will have the midterm practical. Okay, question?
Yes, he just wants you to, Bradley wants you to clarify information on practical. More information on practical. It's from a while back.
Oh, what is he asking? Oh, Bradley. Bradley's asking about, can you clarify information on the practical today when you get the chance? If you have specific questions, come on to a help session, but I can tell you the practical will be 52 questions. It'll be 50 regular questions, 2 extra credits. They will be live on the body. It's just going to be pulling from everything up to and including next lab. Right? It'll be all that stuff. So you need to watch the lectures much. Again, today I'm going to post up all of the quizzes that I did during the spring so you can practice a little bit, and then that might bring up more questions. So you have plenty of time all this week, all over this weekend up until Monday to ask for extra help sessions. I'm going to have some, but if you need additional help, don't hesitate to contact me. All right? Let me know, and I will do it. And if you, the best way to do that is to send me a text. That's probably the best way to get me. You can try email too, but if I don't respond to that email, like a half a day, text me. Don't wait, right? Text me and set up a time, and we'll do a help session. I'll talk about it. But you really need to see the quizzes first. So let me post up the quizzes, do a couple of the quizzes, and then ask me about how the practical is going to go, because the quizzes will answer a bunch of those questions. All right. So I'm not trying to be like not answer it, but it's easier if you see it first, right? Do practice a little bit, and then ask me questions about it. Okay, so I will post up all that stuff momentarily. And beyond that, if you guys need help this afternoon, jump onto a help session. Otherwise, I'll see you guys on Wednesday. All right, bye.